Hello, and welcome to Setsudan Hospital. If you are currently watching this video, the outbreak of the N7T virus has now reached epidemic status. Do not be alarmed. There is no cause for panic. At Setsudan, we can assure you that your safety is our #1 priority. Please attend to the following guidelines on how to ensure your survival in the face of an outbreak. Identifying early onset of an N7T infection involves immediately recognizing the early symptoms. The infection process has been classified into 4 distinct stages. Stage 1: lightheadedness, drowsiness, minor headaches. Stage 2:
No! I'm not sick! Hello? You can't do this to us! Open the door! Hello? Hello? What? Get me out of here! Please, someone! Please, let me... Oh, God.
So, what can you tell us about the N7T virus?
As far as we know, the N7T is a neurotropic virus. It bears a heavy resemblance to the rabies virus, entering the brain via the peripheral nervous system and causing acute encephalitis. This results in headaches, fever, confusion, and most of the time, hallucination. But unlike rabies, N7T is extremely fast-acting and seems to be able to target very specific areas of the brain, such as the amygdala.
Is it fatal?
There have been some cases, yes, but not as many as you'd think. Most patients tend to live, but they do experience extreme symptoms.
Someone, please, someone let me out! Hello, someone! You okay? I'm sorry. I don't want to die! No, honey, no, I'm sorry.
discoloration of skin. Stage 4: a distinct and insatiable craving for human flesh. With the help of these guidelines, a thorough self-diagnosis can ensure an early detection of your infection. However, if an incurable and inevitable zombification is a realization that you rather wish to delay, we suggest you do not attempt to self-diagnose and try to forget the guidelines we just mentioned. In the very likely event that you discover that you are infected, it is important that you...
感じの状況は
急に運ばれてきて高熱があるみたいなんです。
分かった原稿チェックする
はい。
分かった
Drives them utterly insane.
What have you been doing to treat the virus?
So far, treatment is purely symptomatic. At the moment, the best we can do for patients is treat their pain while we work towards finding a cure.
And how close are you to finding a cure?
It's hard to say. This is something very new to us, and we still don't have a complete understanding of it.
But isn't it true that the virus was developed here at Setsudan?
I'm sorry, what?
Well, prior to showing signs of infection, nearly every patient reported checking out of Setsudan Hospital.
It's quite possible that the virus originated near Setsudan, but its exact origins are unknown.
And what about the malpractice suits? People are saying Setsudan is responsible for the outbreak. What do you have to say about that?
Look, I get it. A lot of signs point to this virus being designed by someone. No other virus targets specific areas of the brain as deliberately as this one. But if someone were developing a virus in this hospital, I would know about it.
Yes, you would.
What are you saying?
Doctor, we have evidence. Several of your staff members have already told us about your little experiments. They say you've been tampering with the operations, giving patients irregular and unapproved treatments, and trying to keep it a secret. What do you have to say for yourself?
Well, I guess it was only a matter of time.
I suggest you find an attorney.
No, it's far too late for that.
Stop it! Make it stop! Make it stop!
We would like to choose this time to remind you that it is important to remain calm under these extreme circumstances. Please do not panic. I repeat, do not panic. In order to ensure your survival, maintaining your composure is essential. Do not, under any circumstance. That was a test. If that scared you, you have failed to maintain your composure. Please try not to do that for the remainder of this video.
押さえるんだ。押さえて。怪我をしないように押さえるんだ。大丈夫。怪我をしないように押さえてくれ。押さえて。ちゃんと押さえるんだ。ちゃんと押さえて。下をまた使って。大丈夫だ。絶対下を感情しない。押さえてるから俺は仕分けです。下がる下がる下がる。
Have they begun eating each other yet?
What?
The patients in Juyobi. Have they been eating each other?
What the hell are you talking about?
Okay, no. You'll find out.
Did you or did you not play a role in creating this virus?
No, it's much... I'll put it this way. The N7T was my brainchild. I've been developing it, perfecting it, for years, and now it's all coming together.
So this was all...
Yes, I created the N7T virus.
Why would you do something like this?
At first I did it just to see if I could. I mean, I've always been fascinated by the brain. It's what defines you. It controls your personality, your likes, your desires, your fears. Make any change to it, even the slightest alteration, and you can become an entirely different person. Once I realized the potential of the N7T, the sort of power that I could tap into, it became an obsession.
And what went wrong?
What do you mean?
Surely you didn't mean to cause an outbreak like this.
No. This is more or less what I expected.
What?
Be advised, not all individuals in lab coats are doctors. It is possible that several of our patients have commandeered lab coats and are now masquerading as doctors. If you see someone in a lab coat, do not assume he or she is a medical professional. Remember to wash your hands as frequently as possible. The N7T virus is extremely contagious.
The outbreak is only the first step. Soon the N7T will become waterborne. That's when the fun starts. By the time it goes airborne, well, I won't ruin the surprise.
You planned this? You did this on purpose?
Well, yes, but it's all part of something much bigger.
Bastard. Bastard!
You seem upset.
Why? Why would you do this?
I can't really explain it to you in a way you'll understand. Not yet, anyway. But soon, everyone will understand.
You're a monster! Ugh. I should kill you right now! Do you realize what you've done?
Of course, I'm going to be the man that changed the course of human history. I'm evolving us as a species.
What? By driving everyone insane?
Oh, come on, officer. Everyone is insane. You know that as well as I do. That's how we all got in this mess. We pretend to be sane, but there's no such thing. It's all subjective. Some are just more sane than others. And I think it's time we level the playing field.
So you're trying to kill us all?
Oh, no. Oh, God, no. It's going to be much worse than that. For you, that is. Only the strongest of us will live on to see the new era. The rest will be overwhelmed by the madness.
You'll lose your job for this. You'll be rotting in a cell for the rest of your life.
My job? You think I care about my job? I don't think you quite understand the severity of the situation, officer. The things you are about to witness will make you reconsider everything that's important to you. What you've dealt with so far is only the beginning. You won't have time for your job. You won't even have time to prosecute me. You'll be too busy trying to survive.
It is very likely that your loved ones will succumb to the infection. Be advised, after reaching stage 4, your former friends and family members will stop at nothing to devour your flesh. Do not hesitate to murder them. And rest assured, in this stage of unrest, martial law has been declared and murder is no longer punishable. But be advised, in this stage of unrest, martial law has been declared and murder is no longer punishable.
Bastard! You must have the cure. You've been spending all your time in the hospital, but you're not infected.
Oh, but I am infected. I always have been. I'm patient 0. But I've learned to deal with the symptoms. That's the difference between you and I. I'm strong. I know how to face the madness head on, suppress the pain, fight the urges. I've been doing it for years. I'm going to be one of the survivors. You, on the other hand, will be eaten alive.
You won't get away with this.
I already have. I made sure to put N7T in just about everything here. I even put it in the little bowls of candy we give to the kids. As of now, everyone in this hospital is already infected. The patients, the doctors, the staff, the visitors. Speaking of which, how's that going for you?
What? You mean?
Yes. I'm guessing you're starting to experience the headaches now.
That's... No. Oh, God. Oh, God!
Yeah, just let that sink in.
No! No! I'll kill you!
No, I'm afraid I'm not done yet. But thanks for the gun. I'm sure I'll make better use of it than you did.
In an effort to confuse the infected, some of the information presented in this video has been altered. Please disregard all information that is not factual.
Honey, you're scaring me.
In the likely event that you do not survive, you can die knowing that you tried your best. Remember that death is a natural part of the cycle of life. It happens to all of us, and it is going to happen to you. Contrary to popular belief, death is a sweet release. Those who try to delay the process are only postponing the inevitable and will be met with great, great suffering.